Anna Montebello, and I'm going to be demonstrating how to set up a dressing tray. So first I'd introduce myself to my patient, make sure I have all my supplies in front of me, that I'm working at an above level or waist height, and that I'm not making sure I'm not turning my back to my patient and I'm staying open as I'm doing the dressing change. Okay, so I would wash my hands first and put on my gloves. I would ask my client if they need to use the washroom before I would do this. Okay, I would not be wearing my watch or my ring as well. Okay, so I would get my package, inspect the package, look at the instructions, make sure I have everything. I would open it up, so I'd rip the top open, put this package on my tray, and this would probably be a little bit bigger tray, but for now we'll use this. So I'm opening to the top first, to the right side, the left side, and usually there are some forceps in the package which I could use to open the rest, making sure that I'm not in contact with the field. I would use my forceps and step back, making sure it's above my waist, over and drop. Also the garbage, step back and drop. So using the forceps, I would also make sure I drop all contents onto the sterile field, making sure it's not contaminated. And putting these ones just off to the side. While maintaining a sterile field. Now I'm going to put some solution into the container, and as I put this down, I would make sure that the part I have contaminated, since I'm not wearing sterile gloves, is on the outside. Okay, so I'm looking at the label, instructions, expiry date. I'm making sure the label is towards me. If I have a garbage can available, I could pour a little bit out just to make sure it's sterile. Putting the cap face up, pouring it closely so that there's no splash. Putting it down and back like that. Okay, so I have my sterile field set up. I'm now just going to demonstrate how to open a bandage. I'm not going to open up all of them, just demonstrate one. So I'm opening it up, making sure not to touch it, and I'm just going to drop it down just like that. Okay, thank you.